Every single patient is a new experience, something new to learn. I mean, we learn every day. Every day we learn something new.
That's one of the things that I really admire from you guys is that, obviously we all make money. Obviously, this is the
This is a business.
This is the business, but it's a health business, and the health comes before the business. If not, it's just the business.
Most of the times, the patients don't know. They don't know about it, and they just want to change something on their mouth because they are not confident. They are not happy with it. And next time when she comes here just for a checkup, she told me like she's gonna marry with him.
Wow.
So, and she said it was after she get her mouth.
Hello, welcome back to Supremedental Podcast Studio. You can be anywhere else in the world right now, but you're here with us, and we appreciate that. My name is Frank Navarro. My wife and I are the owners of Supreme Dental Clinic. Don't forget to subscribe. Also, give us a like. We got a email address. We got a phone number. You can give us a call, drop us a text message, leave a voicemail, or you can send us an email with anything you would want us to talk about in the future. Remember, this is for you, the patient. And today we have, for the first time here in the podcast, Mr. Dr. Joel. How you doing, Dr. Joel?
Hello, Frank. I'm good. I mean, my first time here. It's a little nervous, but okay. Let's talk about all the doubts that the patient have.
That's perfect.
All
That's
right.
perfect. Dr. Hood just came back from vacation.
Yeah, I just get here yesterday.
So you're nice and fresh.
Well, kind of.
Kind of. Yeah, you need a vacation from a vacation.
Yeah, sure.
So, Dr. Joel, we've been asking different of our doctors that we put here. We ask them different questions. We ask them different advice that we have. But one thing that I've never asked any of the dentists is, you're I call like a hybrid dentist because you do from fillings to full mouth restorations with crowns. You do veneers. You do implants. You do all on fours. You recently started doing nasal floor lifts. You do sinus lifts. So you are everywhere. You've been proceeding with your studies. You just came back from Argentina about a month and a half ago or something like that.
Okay.
So I want you to tell me a little bit about everything.
All right.
I want you to tell me, what do you think, what are some of the cases that you get? For example, when somebody comes and gets, say, for example, I'm the patient and I come in and I say, well, I want to get a full mouth restoration. What are some of the things that you encounter while you're with the patient? What are some of the things that you see? Perhaps some patients only want the front six, but you can't really do the front six, so you want to do all. How do you explain that to the patient? How do you explain to the patients out there that are talking about, oh, well, I only want to change the front six? What do you think that we should let the patients know?
Okay, Frank. So that's a very good question because most of the times the patients don't know. They don't know about it, and they just want to change something on their mouth because they are not confident. They are not happy with it. They have some things on their mouths that they don't like it, and they just want to change the things that we can see when they smile. So we need to search every single problem on the patient's mouth and explain them why they can get just, for example, just the 6 teeth on the front, because we need to lift the bite. For example, that's a very common problem on the patient, that they don't have space to make to put just the front crowns, and we need to open the bite to make a space for all the crowns. So we need to see first. We need to check if the patient can get just for cosmetic purpose, just the front ones, or for functional purpose and cosmetic at the same time, all of them. And most of the time they need to get all the crowns, not just the 6. If it's possible, of course, we can do it. Just 6 and 6 or 8 and 8. And it'll be great, and it'll be cosmetic, and we can change the smile. But when the function of a bite is involved, we need to change something on the backside to be able to change something on the front.
So aesthetically, if they want to change the front, not always you can only change the front.
Not all the times.
Sometimes you need to change the back to give the space for the front for it to be functional.
Exactly.
Because that's the number one thing that we go for is we have to make sure that everything seals, that everything is perfect, that everything hits at the same time. It's not just about aesthetics. So a lot of times patients come in and say, I just want to change my front six, but the teeth in the back are very small, but they want bigger teeth in the front. And you can't just let them hit in the front because it's like walking in tippy toes. You know, it's gonna break. It's gonna be worse. You're gonna make things worse.
Exactly. Some of the crowns can break if we don't have space to put them on. So that's why we need to create that space. How are we going to create a space on the front side, on the front part of the mouth, doing a little bit bigger on the back side. So that's why sometimes the patient don't understand why you want to make me spend more money, or why you want to make me to do some more crowns if I just need 6 on the front to make it look better. And I say, no, it's not because we want to, it's because you need it. So we need to give the best for the patient, to give him everything functional and aesthetic at the same time.
That's one of the things that I really admire from you guys is that, you know, obviously we all make money. Obviously, this is the
this is a business.
This is the business, but it's a health business, and the health comes before the business. If not, it's just the business. So we get other clinics. There's good and bad clinics everywhere, but that are order takers. So the patient comes in and says, I want the front 6. They'll do it. They don't care if there's not enough space. And then 4 months later or less, the patients come with their teeth in their hands. You know what happened? Well, they didn't fit. And we told you they didn't fit. And those are the consequences. You know, you guys let them know what's the best option for them in the long run, not just for the first 4, 5, 6 months. They want them to invest their money right.
Exactly.
So now tell me a little bit about implants. So I've had some patients that come in, as you know, and they come in and they want to get a full mouth restoration, but their teeth are very loose. How do you explain that to a patient that just comes in, or the patient that wants to get those implants done, but they have no bone? What exactly do you say to them?
So that is very, very hard to us, because sometimes the patients already have some diagnosis or quotes for another dentist, especially in U.S., but that's not affordable for them. So they want to have a second or third opinion, and they come with us and say, no, it's because my doctor in U.S. told me that I need to do crowns. And I said, okay, how I'm going to do crowns on a tooth that is moving? So it's very hard to explain them why I cannot do it, because someone else already told them, like, it's possible. So it's hard to believe in someone else, especially someone new that they don't even know. But we have very good technology right now. We have digital x-rays, we have CT scans, we have very good cameras. We can take videos, we can take photos, we can show them some before and after. Some patients that we have a lot of patients on our tablets or whatever, and they can see the difference, and they can see before and afters, and we can explain them why we cannot build a house if the ground is not good enough. I mean, you're gonna invest a lot of money on a lot of work, and then that work, it will be beautiful, but it will fall down with the teeth. I mean, you're not gonna lose the crown. You can lose the tooth as well.
It's about the foundation.
Exactly. Foundations is the most important thing when we're gonna do a full mouth restoration. Sometimes the teeth look really bad, but they are savable with crowns. Sometimes the teeth doesn't look very bad, but they are so loose because the foundations, the gums, the bone, the ligament, everything is receding or is it's just gone. So we cannot do crowns on those teeth, and we have to extract them all and place some implants, and then put something better for the patient, and something that we know that will last longer, and it will be better and more reliable in the long term.
Welcome to Children's Dental Facts. Did you know that bad teeth are stopping kids from smiling? You heard it first at Supreme Dental Podcast. If you didn't know, well, now you know.
So you just came back from Argentina.
Yep.
Talk to me a little bit about Argentina. Talk to the patients a little bit about what was the training about. What do you think you learned from the training, and what was Argentina like? Especially having you're a dentist from Mexico. I mean, obviously we know you're ADA International member, but you go into another country with dentists that have the same field as you, but somewhere else. What was that like?
Yeah, no, it was a great experience. It was something like huge. I mean, it was a worldwide congress. It was very important. People, really, really important people was there, like Dr. Sukeli, Dr. Isvan Urban,
We'll post some pictures right now.
Yeah, so now those doctors are the guys who write the books. I mean, that we used to learn at the school. So met them, be in front of them, have the opportunity to take a picture with them. So it was incredible. I mean, it was unbelievable because we never. I mean, at least not me. I mean, I never think about it. I mean, I never think like one time I'm gonna have the opportunity to be in front of them, of him or them, and learn some advice. At least one little thing that I can learn from them is huge, and then I can apply that to my practice and give the most current for my patients. And also the culture. I mean, know a new country and they've never been there before. Their people and whatever, everything gives you more experience for life, and you can apply that to your practice and give something better for the patient. So
I was very excited of you going. I think when we gave you a call, you were on the freeway with your family.
yes, I was.
And I was very excited. So I don't even imagine how you felt to be taking a picture with Dr. Sukeli. To me, I was excited when I seen it, but I don't know what was going through your mind, because that's pretty awesome. That's like if you're a basketball player and you take a picture with Michael Jordan.
Something like that.
Or you're a hockey player and you take a picture with Wayne Gretzky, So it's I was very, very impressed. So what do you think you learned? What are a couple of things that you think you learned from that to bring over here to Mexico, to Supreme?
Okay, something that I just that I have very in my mind right now, something that I know that I learned and I never forget, is one technique that Dr. Sukeli have to put the implants, and he told us not all the time it's necessary to do a bone graft or do it a bone regeneration. He managed the tissue, the soft tissue, like no one else. So it was incredible. I don't think I can do it just like him right now. I need a lot of training to get that, but at least a couple of advices he told us, and he put it on the screen. There was very interesting, and we can try a little bit of that. Not all the thing, because it's a lot of years of experience and a lot of school and practice to get there, but at least try to preserve the soft tissue and give more cosmetic result for our patients. So that's something that we can start applying, like playing with healing caps, and make the healing cap last a little bit longer on the mouth, like make the shape of a gum to make the tooth the appearance, I mean the more natural coming out of the gums, so, and look more like a tooth and not like a crown. That's something that we can apply on our daily practice.
Well, obviously Dr. Sukeli he's one of the tops in the world.
Yes.
But you're obviously a lot younger than Dr. Sukeli, so you got a long ways to go. You got a lot of years to do it, but I think you're obviously in the right route.
Yeah.
So tell me, I've been asking a lot of our doctors here. I ask them if, obviously you've done so many crowns with us. You've done so many implants with us. You've been with us for quite some time. I say that we know a thing or two because we've seen a thing or two. I think we've seen, no matter what they're throwing at us, I think we pretty much have seen most of it. But what is one of the patients that throughout your career here at Supreme, you remember one thing that a patient in particular that you either pulled their teeth or you did their teeth or you gave them back teeth that you remember that really touched you, that really, because obviously a lot of our patients think, oh, well, they don't care. They're just going to work on their mouth. But there's a lot more to that, because when that patient does cry or he sees himself or she sees herself for the first time, that's your guys' work. When they smile, they're representing your work. They're representing Supreme, no matter what part of the world they're in. So what is something that really just comes on top of your mind?
Yeah, so I saw a lot of patients on Supreme Dental, and I have a very good experience, and I can define by just one patient or just one experience, because there were a lot. But I have a couple of them. They even cry on the dental chair, because they saw the huge change that we did in their mouth. And when we finished the final restoration, they were crying of happiness or joy. I mean, yeah, they were so excited about it, and that was a very good feeling to us, because we are feeling like we are helping people, we are changing people's lives. So in one of my patients, she told me like we literally changed her life, because she was working in I don't know where exactly, but she said in her work it was a guy, and never look at her, and until she come here and she do her mouth, all her crowns, and her smiles changed a lot. Actually, on the meantime when we were doing the crowns, she go and change the color of her hair, and
She changed her whole appearance.
yeah, all the appearance, and because she was changing her mind. I mean, she was feeling more confident.
She's a brand
now.
new person.
Brand new. So when she went back home and she go back to the work, a guy just start like working with her forever.
Started noticing her.
Started noticing her. So he was like, okay, what happened with this girl?
Who's this
So
new
just
person?
I mean, just like attract her, and she said, okay, why not start dating with him? And next time when she comes here just for a checkup, she told me like she's gonna marry with him.
Wow.
So, and she said it was after she get her mouth done, because she didn't even know, she didn't even think about it. But I tell them, okay, just start smiling, probably a little bit more confident, being a little bit more secure about her aspect, and that guy just noticed.
So did you actually help her out or didn't help her out? Because she got married now.
Yeah, no, we did. I mean, we helped her.
But was it a good thing or a bad thing?
A good thing.
Because now she's
Yeah.
getting married.
No, okay. It depends. How do you see the thing? But yeah, no, she said she was happy. She was. I mean, we literally changed her life because of her work, her smile.
Yeah.
She can probably get something.
I got a clip from Dr. Joel when he says that somebody is in the dental chair and they look at themselves for the first time with teeth or with nice teeth, and they start to cry. We actually captured that on one of our cameras, and we're gonna put the clip up here. George will put the clip, and it shows when that patient was crying. It's not high definition because it's on one of our cameras, but it was a.
I remember that guy. He was the first guy who would start with the videos. Actually,
Yeah.
he was the first one to make us give us a interview or something like that.
Oh wow.
So this is how it starts. I mean, with that, I think. I mean, I don't know, but he was one of the first ones.
So Dr. Joel, we know that you do many different things. You're also married. You're also a father. So how do you do everything? Like a lot of the dentists that we have here are not married. A lot of the dentists that we have here don't have kids. So how do you juggle being a dad, being a husband, being a dentist, being a hero, changing people's lives? How do you do it? How do you, let us know.
So I don't know. It's something that I just try to really hard. I mean, every day I just wake up and try to do the things better than the past day, than the day before. Try to make it better every day, and giving my try to give my best every time I could. I mean, every single patient is different. Every single patient is a new experience, something new to learn. I mean, we learn every day. Every day we learn something new. Every day we it's an opportunity to be better. So that's how I do it. I mean, I just try to make it better every time.
Yeah, actually, I have had many conversations with you, and every time you just get better. So we talk about certain things, and you just get better at it. And I remember looking at your pictures of before and after and being like, wow, man, this is pretty awesome. And you just keep on getting better and better and better and better. And that's awesome, because a lot of dentists stop at a certain area and say, I'm good. I don't want to keep on learning. I don't want to keep on redoing myself. Like, it's in you guys don't stop, particularly in your case. You always push yourself forward, and obviously you got a lot of motives to put you. You got, your baby, you got your wife.
Motivations, yes.
You got strong motivations. So, we want to thank you so much for being here. Also, we want to take the time to say thank you to George. George captures a lot of the videos. We're not artists. We might look like artists. I'm just kidding. But we're not artists. We don't do this for a living. He's a dentist. I'm a business owner. This is something that we just came up with, and we came up for you, for the patient, so you could ask the questions, so you guys can see pretty much like the VIP, go behind the scenes and see why things are done, how things are done. And George is very good at captivating those images of those pictures of those videos. That was his phone too, of those pictures of those videos of how to capture them when things are going on and all that good stuff. So we want to say thank you to him. And we want to say once again thank you to Dr. Joel. You've been here for quite some time, and I know you actually just finished up on a patient, and you came over here right now. So thank you so much. Keep on doing what you're doing, and we're going to see a lot more of Dr. Joel in the next episode. So thank you so much for joining us here at Supreme Dental Podcast Studio, and have a good one.